know that half of all infertility cases is due to male factors, which boils down to one thing alone: sperm disorders. So today we are going to be breaking down sperm disorders, because I keep saying it that infertility is contributed by both male and female. So today we are going to be talking about what are the things that causes male factor infertility, which is sperm disorders. Sperm disorders are problems that refers to how sperms are produced, the number of sperms produced, the shape of the sperm, and how the sperm moves. So if anything happens to any of the shape, the number, or how it moves, it can make a man infertile, making him unable to impregnate his fertile wife. So now you see that infertility is not only the woman, it's also contributed by the man. There are several things that can make a man have unhealthy sperm. So what are these sperm disorders? Number one, we have what we call oligospermia. Oligospermia is a condition when the man have sperms available, he's producing sperm, but the number is not enough to fertilize a woman. So he is having sperm, quite all right, but the numbers are not enough to fertilize a woman. So that's oligospermia. Another sperm disorder that can affect a man is what they call Azoospermia. It means zero sperm, empty concom. The man is releasing semen. You make love with your wife, you are ejaculating, but at the end of the day, that semen, there is no sperm inside. So your wife will not get pregnant because there is no sperm to fertilize her egg. And this is very, very common. That's what we call low, the oligospermia is what we call low sperm count. But the azoospermia is zero sperm count. Number three of the sperm disorder is what we call asthenozoospermia. This means that what? There are sperms, the number is adequate, but the rate at which these sperms swim is very low or zero. It means that the sperm is not swimming at all, or is swimming at a very low rate. And a man's sperm is supposed to swim in a very fast manner to meet the egg on time to fertilize it before our ovulation period passes. So once you're having asthenozoospermia, your sperm is not swimming as fast as it can to meet your woman's egg. So that month will pass without our egg being fertilized. Month in, month out, it leads to infertility. The last of the sperm disorder is what we call teratozoospermia. This is when the sperm is having abnormal shape. In this case, the sperm is there, the number is adequate, it's swimming well, but the shape is not good. In this case, you can have things like a headless sperm. And once there's a headless sperm, there's no acromion to even pierce into the egg and fertilize it. There can be a tailless sperm. The shape of the sperm is abnormal. So now you see that infertility is not contributed by only the female or only your wife. It can be contributed by you, the husband. Once your sperm is unhealthy, it means that it cannot fertilize a woman's egg, leading to infertility. So that's why when you try to get pregnant, when your wife tries to get pregnant, month in, month out, year in, year out, and it's not forthcoming, don't just fold your arms and say, I'm the man, nothing is wrong with me. Go for a checkup so you can know what is wrong with you. It can be from you. So what can we do, or what are the causes of this sperm disorder? Number one, this sperm disorders can be genetic. It means that it can run in families. So your brother A is not able to impregnate his wife. Brother B is not able to impregnate, and you now you can't impregnate your wife. You should check it out. It can be something that is running in your family. Number two cause of sperm disorder is infection. Long-time untreated infection. Infection like STI, sexually transmitted infections. Infections like mumps. When you have swollen, it means that what? It can have the tendency of having sperm disorder. Number three is when you're smoking. Excessive smoking, excessive alcohol intake can cause sperm disorder. Use of drugs like steroids can cause sperm disorders. Excessive heat, exposure to chemicals, radiations. That's why we keep telling men, don't wear too tight boxers, because the sperm has a temperature it works to produce its sperm. So once you are increasing the temperature, it will get this signal that this temperature is not enough for me to produce my sperm, leading to low sperm count. So try as much as you can to wear free boxers. So now you see that several things can lead to unhealthy sperm. So your lifestyle is very important. So what can you do if you notice that you have these sperm disorders? The first thing you would do is to go for sperm analysis or semen analysis. When you go for semen analysis, it will tell you if you're having oligospermia, if you're having azoospermia, if you're having asthenozoospermia or teratozoospermia. It will tell you. And that way you already know what to do. You know the problem, so you know how to solve them. Another thing again is lifestyle changes. Change your lifestyle. So you're smoking, cease from it. You're taking alcohol, reduce it. If you're stressed, take care of your stress level. If you're taking drugs like steroids, eat well. Drink enough water. There are drugs that we can give in terms of treatment. There are drugs we can give in terms of treatment. Some persons even take supplements. So now you see that if at the end of the day, this thing keep going and going, maybe you have azoospermia, there are things that can help in terms of getting pregnant. You can go for assisted reproduction, like IVF. It will help. So let's be conscious, even as men, that something can be wrong with your sperm. Something can be wrong with your sperm. So don't always attribute infertility to your wife. Don't make her feel like she's the whole problem. You should try as much as you can to seek for help. Talk about it. Go for help. Get drugs medically, supplementally, and be checked well. And I want you to know that sperm disorders are treatable and they are preventable. So all you need to do is to get your lifestyle changes, eat well, go for your investigations, rest, cease from every smoking and alcohol intake, and be rest assured that that condition will be solved out. So thank you so much for stopping by, staying till the end, and make sure that you like and subscribe if this video was helpful. But at the end of the day, always remember, sperm disorder is not a life sentence. It is treatable and it is preventable. See you next time. Bye. If you have question, drop it at the comment and I will answer. Bye.